welcome to the Breaking Limits Empowerment session. If you can take the time and just put in the chat a fun fact about you. Tanisha, you can't hear. So let me see. Everyone else, can you hear me?
Denise looks like she's muted and she's not anymore. Tanisha is still muted.
Okay. Okay. So can everyone hear?
I'm hearing.
Okay, good. So there's something, I guess Jacqueline is, let me see. Someone's having technical difficulties getting their sound. Tanisha. She might need to adjust on her computer, or if it's her phone, she might need to adjust the sound on there.
Fun fact, fun fact.
So if you can please just write in a fun fact about you, I greatly appreciate it.
Is somebody singing?
Hey, I big picture for that on the wall. That one don't know your band. Fun fact, fun fact.
Okay, I'm gonna give you one more minute for a fun fact and then we will move on.
Yes, Tanisha can hear us.
Okay, great. Thank you. Thank you for checking on that, Andrea. Well, I'm glad to have everyone. Thank you so much. So, Andrea, can you read the fun facts?
Sure. Hold on.
I think a fun fact. Yes.
So Denise says, I still sing songs I sang to my kids when they were small, and I enjoy them just as much as I did then.
Awesome. Awesome.
Hold on. She said, no shame, by the way, laugh out loud. Oh gosh, and my fun fact is that I did get an opportunity to go to Miss Universe in 2011 when Shakira was Miss Jamaica. Wow. And it was held in Brazil. It was a great experience.
Wow, nice, love it.
And Mishka wrote great poems. Mishka, we have to hear some of those.
Yes, we definitely do. Thank you, great. Well,
and Nurse Fletcher wrote, I love needlework. Okay, we know that.
Nice.
I know that.
I got some beautiful jewelry from her, so can't wait to.
No.
Anyone else?
Anyone else want to share a fun fact? So I'll share my fun fact. My fun fact is that I actually went to beauty school, but I really did it for a while just to work. And I really hate to do hair. I don't like doing hair. My children know I don't like doing their hair, but I have to. So that's a fun fact about me. So I became licensed and all. So I did it for a career for a while just to get myself through school. But that's not something I enjoy. For myself, it was good to do my own, but didn't like really doing anybody else's.
Oh, look who joined us. Come on. Hi. Oh my goodness. There's a lot more to read, Carla.
Okay, great. Go ahead.
Okay. Let me go up.
Research is somebody if you sit down and pass some of the research and what have to do.
Who's talking? Mute your mic.
Yes, if you can all mute, that'd be great. I appreciate it.
Okay, Kimon says, I'm great customer service rep.
Nice, Kimon.
Oh gosh, and Chrissy says, hold on. She loves to embroidery. My fun fact I like to do is embroidery.
Nice.
All right, who else?
Well,
and then who's this? I love reading, doing researches, and I was also a spelling bee champion for Kingston in 1995, which is still a great memory.
Awesome.
And who's that wrote that? Let's see.
Can you share your name? Who wrote that? Who wrote the that they got the spelling, won the spelling bee for Kingston?
Anisha.
Okay,
Yeah,
nice.
awesome.
Do we have any more?
That's it so far.
Okay, great. Well, I thank you and we welcome you to our Breaking Limits Empowerment session. This is meant to be a empowering, relaxing, and just interactive session. So please don't feel shy here. We are here for your support, as well as we have some exciting things that we want to get through even through this session. So I am going to take time and allow Andrea to also give you a little bit of information about Shak's hopes. Right now, the session is not intended to promote any particular medication. This is the disclosure or perform diagnosis or provide medical advice. So all medical questions should be directed to your physician.
Okay.
Our voice and this is this is our fight. So this is our voice, our fight, and our hope. I'm going to allow Andrea to tell you a little bit about herself and Shak's hope.
Okay, everyone. So Shak's hope was actually the brainchild of Shakira Martin. When she was doing Miss Jamaica, she chose sickle cell as her platform. And she always wanted to ensure that because sickle cell warriors were sick, that they would always receive anything to lift their spirits. So it was mostly about how it affects all warriors mentally. So it took her some time, but she formed her foundation in 2016 in January and really lost her battle in August of that year. So I am continuing the legacy along with Paul, my husband, and the other board members and our supporters to raise awareness, to get people to know their status, and most importantly, to bring joy to the lives of those living with sickle cell here in South Florida and in Jamaica. And that is what we're about since 2016 till now.
Thank you. Thank you so much. So just sharing a little bit about our voice and our hope and our fight. Just to let you know, that's a picture of my son, Shamar. He started my journey and my interest for sickle cell. He was diagnosed with the newborn screening here in Florida when I first moved to Florida. That was the impact of my life and realizing that wasn't enough resources here for patients and parents living with sickle cell, and not even for the medical professionals here. So our focus for Kids Conquering Sickle Cell is education, advocacy, and outreach. we pretty much also developed a program that we are pretty much based in Florida, but we are a organization that pretty much focuses on the United States, and we have a program, a now international program called One Love Program. So we're extending our work that we are doing. We started as a support group in 2004, and we developed to a nonprofit organization in 2014. So been in the trenches for a while. So I'm so thankful to be here today, and I am going to start next with a trivia. So what country has been most impacted by sickle cell disease? Put it in the chat. We want to hear. Put it in the chat. If you can just type that in the chat. And then Andrea, you're going to read the first response that we got.
So Denise wrote that she didn't know.
Okay.
Mishka wrote the United States.
Okay.
Kimon wrote Jamaica and Africa.
Okay. Come on. Okay. So we'll give one more second, and then I will give that answer.
And I did say Mishka, right? The United States?
Yes. Mishka.
All right. And Nurse Fletcher wrote Asia.
Okay. All right. So the country that's most affected by sickle cell disease is Africa, Nigeria. So Nigeria has the most impact of sickle cell disease. And we know that pretty much a lot of from the knowledge of research that sickle cell is prevalent from areas that were close to the Mediterranean area. So Africa is the key answer, and Nigeria is actually the place that is most affected. I am gonna, let me see. Thank you for your response. So we are going to start off by talking about our strengths within. So I want to thank you because someone in the beginning mentioned that they won championship for spelling, and that's a celebration, right? Being able to celebrate milestones and accomplishments, not only for those living with sickle cell disease, but for all of us. So I think it's so important for you to recognize your celebrations, your milestones that you can think of. Can anyone share a celebration? You can put it in the chat, something whether you recently celebrated or something that is worth just sharing, that you just feel that it'll be great to share. You don't have to, but we'll like to hear, what is a celebration that someone celebrated that you would like to share? If you can just put that in the chat, I greatly appreciate that.
Carla, I'm laughing because Kimon, right? I came close, me bright.
Yes, you are. You're right, Kimon.
And she also wrote my son, and it's her celebration. And Mishka also wrote her son as well.
Yes. So those celebrations of having children are definitely something for us to embrace. And then one of the important things for us to do is also set goals, right? Because I even heard a little bit about things that mentioned that you like to do. So we have those that are good with the needle, right? And those that are able to whether make crafts, whether to and make crafts and sell them, right? That can be a goal, right? Because you love, this is something you enjoy. And also simply just doing things that you love, that you can set a goal on doing. Sometimes that accomplishment may be, I graduated from a program. I graduated from school, right? that could be also something, a celebration, as well as setting a goal. It doesn't actually have to be, some people are great at trades, good with their hands, being able to accomplish those things are celebrations. So I feel like even in this time of dealing with the pandemic, it's good for not only our warrior community, but just us all to just set goals. And I'll talk about a little bit about setting goals and what we can actually do to continue that celebration of setting goals. Knowing whose you are and your purpose. So let's talk about that, Andrea, your purpose. So what do you feel your purpose is, Andrea?
So my purpose as an advocate is to tell everybody that I know, to get to know their status. I do it everywhere I go. That's why I'm here. That's what keeps me going. And to make sure that as many people as I can talk to as possible, that they know their status so that we can prevent sickle cell awareness. That is my purpose. Absolutely.
Yes. Thank
Absolutely.
you. Thank you for sharing. And I had to realize too, even in my advocacy work, like I said, I was a mom that pretty much saw a need in the community. So my purpose kind of shifted. A lot of people don't even realize or recognize, prior to me actually having my son, I was an elementary school teacher. I taught 4th and 5th grade students, and that was elementary for here. And it kind of switched. I also became a social worker in the hospital, and prior to actually when I had my son, so I switched careers during that time in order to better care for him and have more flexibility. So it was a transition, and I realized my purpose really was not only walking in the light of caring for my child, but also caring for others that need assistance and help. So we can sometimes realize what our purpose is, or God shows us who our purpose is for those that believe in God, but that is my maker, that's my everything. Showed me what my purpose was when I actually had my son. I always knew and always worked in a social work field, where I was caring for others in some capacity, either volunteering or in other ways. And even when I became a teacher, I was caring for other children as a teaching them, and just joining into other opportunities. But I realized my purpose was always having a heart for people, caring. So understand what your purpose is. Anyone want to share what's been on their heart as their purpose? If you want, you can unmute yourself, or if you want to type it, you can type it in the chat if you want, or if you feel comfortable, you can unmute yourself. It's okay to share. Like I said, this is going to be an interactive session.
Can I share, Carla?
Sure.
Dennis, yes. My purpose is to bring creativity to the awareness of as many people as possible, of the power of creativity in being able to shift their lives on a daily basis, and to help them to rise above their current circumstances.
I love that. I love that.
Yeah, absolutely.
I love that. So that definitely, being creative is definitely a mindset, a mindfulness, right? And being able to do that creativity, especially through the arts, any form of arts, where there's creativity doing dance, or whether creativity doing art to draw. So that's very, very awesome that you put your passion in, your passion for what you like to do. That's beautiful. Anyone else would like to share?
In the chat, Nurse Fletcher says, to assist everyone when I can, whilst I can. And Mishka also said, my son keeps me alive.
Yes, that is so awesome. That is so awesome. So definitely caring for others will drive our passion and our purpose to do what we love, right? And do it and enjoy it. So that's so important. And then our support. Support is so important. And sometimes even as warriors, we don't feel, as warrior moms, we don't always feel supported. I remember times that I was in the hospital with my son, and it was only myself or my family, pretty much my immediate family. So whether it's my children or my husband is the one that basically we're there kind of taking shifts and visiting. It was only us. And that journey felt so lonely for me. But in the same time, because I'm a person that pretty much leans on my faith, I pretty much thought to myself, we're doing this and we're doing it well. So even the staff that came in, volunteers that would even come in, they became a part of, I would say, my network family of my sickle cell life. And then, of course, when I started advocacy, that was a more support, because then I felt like more moms and more warriors understood the journey. So we can also talk about our support as being one of our strengths within, because we gain strength even from our support that we have around us. And sometimes the support that we need, or we think we need, we don't have that particular support, but we can definitely generate our support, generate who's willing to support us. And just like the passion, so that the ones that are passionate about sickle cell, the ones that are living this, the warrior moms, the siblings, it's so important. The children of warriors, right? That's also important. And definitely spouses. So just the family unit, our support unit doesn't always have to be the family that we expect to support us, but sometimes it's our friends and loved ones around us that knows this fight and journey with sickle cell. So sometimes when you feel alone, can you think about your support system and what do you use to encourage you? Anyone willing to share? What do you use to encourage you when you're feeling that your support system is not feeling so supportive at the time? What's your encouragement?
Well, if nobody else,
Join in, it's fine.
Okay. My son is 43 years old now. I'm so grateful and so blessed for that. And he recently said to me, he held my hand. He said, "Mom, I want you to hold your hand," because he's currently going through yet another challenge. And he said, "I want to thank you for everything that you have done." So I'm thinking, it's the challenge that he's going through right now. And he said, "I don't mean just now. I mean from the womb." So sometimes for me, the support is actually from the person who I am supporting. So it is, you want to tend to think that, you have to find, whether a doctor, a caregiver, a mother, a father, whoever, but sometimes the person themselves who is going through it, just the strength and the stoicism and the power that they exhibit for having gone through so much and still standing, they give you that renewal of focus and continuity.
Yes.
Wonderful, Denise.
Thank you, Denise. I really appreciate you sharing that, because that is so important. And I know that even for us, Andrea and myself, Andrea, you can share a little bit about so much how Shakira have given you your strength.
Yeah, I just wanted to, because a lot of typing is happening in the chat.
Okay.
So Tanisha wrote, "I use God."
Nice.
Simone said that she's unable to unmute to speak.
Okay.
And Shawana, happy to see you in the chat. To see you joining us today.
Thank you.
Let me see who else. One moment. And Mishka wrote, "I believe my purpose is to motivate and be an inspiration to others through my pain, to be a living testimony and to make a difference in the world, to raise awareness about sickle cell disease, and in the future, give back to sickle cell warriors through charity."
Love it. Love it. I love it. Love it. Thank you so much. I realize that definitely our strengths come from so many places. And I love the fact that, what it Mishka that said about giving back to charities?
Yeah.
I think it was Mishka. Okay. So
Siobhan, I think you need to mute your phone.
Yeah, mine was mine.
thank you. Yes, if you can just a reminder, if you can just please mute so we can just have some clear. Thank you so much. So definitely. Just a reminder for everyone, if you can please mute yourself.
But it may fight me long time.
Shawana, turn off your mic.
You may not know how.
Yes, I
I
don't
think
know.
one of you would have to mute her. One of
Okay,
the
I
hosts
think,
would
yeah,
have to.
hold on. I am going in and muting.
Yeah, she's muted.
Okay.
And then Carla, Tanisha wrote, to bring knowledge and understanding to people about anything that is worthwhile and important. I love to help people on whichever way that I can.
Love it.
Chrissy wrote, reach out to my fellow warriors. Yeah. Oh, goodness. Anything else? Okay, I think that's it for now.
Okay, great. Thank you so much for sharing that. That is so important because that gives us strength, and just wanting to help others. That is really so important. And we could just following into that subject of the power of one. So the power of just one voice and one strength just really brings recognition to who we are as a person. I think it was Tanisha that said she would love to just giving back and helping means so much. That is the power of one, right? It only takes one person to do that, and it's a domino effect for others. So if we all use our power as one person in order to give back and help, we can see the power of helping our very community. And that help could be many ways. Being able to share information about sickle cell, being an advocate. Sometimes you have to understand what the power of your voice can do. Sharing your story, sharing your journey living with sickle cell. I think it was, I forgot who it was on the line, that Denise that mentioned about her son living with sickle cell, and how much, even with his challenges, have brought her strength. That is so important, and using art in order to pretty much being able to give back. And it's a mindset too. So it puts you into a relaxation. It helps with mental health. Those things are the things that actually help us. And advocacy comes in so many ways. Sometimes we have to write a letter in order for our officials to understand that funding needs to go more towards sickle cell, or resources that can help the community, being able to even fund the very facility that have doctors that they can able to travel to the different communities in order to help, because of course there's barriers in traveling, especially in Jamaica. So understanding what you can do and using the power of your voice, and becoming an advocate in your way, what's comfortable and what's in your heart to do. So your advocacy. And then self-care. Self-care is so important when we think about our strength within, because we can't care for others until we care for ourselves. So definitely self-care is something to focus on when it comes to our strength within, because we can only be as good as taking care of ourselves also. And that also has to do with making sure our mental health is on point, and being able to address any mental health issues also.
There's a note, in the chat, Kimon wrote, because she seems to be having some difficulty unmuting herself.
Okay.
She said, my support is my son ever since. I became a mom. It's been a new leaf on life. He's an advocate so far, and because of him, I fight this illness.
Wow. Thank you for sharing that. Appreciate that. Okay. So I'm going to ask, do you guys want to take a 5-minute break right now before we go into our next thing? In order to let you have a break? Or you want to move on, let me know, because I want to be able to be conscious of your time also.
Just continue straight.
Okay.
Move on is the move on.
Okay. All right. So we are going to watch a clip, and this was from a documentary. So there's complications with sickle cell, but we all know that what's the empowering thing is living the complications of the disease, but striving beyond. When we see warriors strive beyond. So there was an awesome documentary that was actually done by Noel Johnson. I'm not sure if you guys have seen that, but it's an awesome documentary. And the university out there actually had a meetup discussion, and they watched the documentary. So I'm going to show some little clips from that documentary that I thought was so empowering. And I will also pass on the information so that you have it for your resource. But this documentary was very, very touching and empowering. So I'm going to stop sharing in order to share the documentary. And let me know if you can hear and see it when it comes up. 1 minute. Hold on 1 second. Do you actually see my screen yet?
No.
Okay. Just want to make sure I got that other screen off. Okay. Whiteboard.
I love what Denise wrote. Oh yes, self-care and self-love is absolutely essential. Yeah.
Thank you, Denise. Okay. Okay. Can you hear?
Yes.
Okay.
Statistician, yeah, statistician, and I was good at it until the stroke, and that now skewered me, and as a result, I can't really do nothing. Can't really walk. Can't do nothing of my capable. But you know, then um, mom was saying, why not um, try art? And I said, okay, why not? And at first I suck, but then eventually I get I was more capable of that art, and had I'm good at art, so I say, why not?
Well, um, Kit's experiences stroke at 25, as he shared. Well, the background, obviously, he was born with sickle cell anemia.
Yeah.
And his life journey really was about a lot of pain, but a hospitalization, in and out of hospitals. And in 2005, which was the year of that he had his stroke, he came down with a very bad cold that developed into what they call acute chest syndrome. And that syndrome landed him in the ICU, and it was in the ICU that he actually had the strokes. They were devastating, and didn't expect that he would survive that trauma, but he did. And basically, as he said a while ago, he used to be a statistician. He worked with statin, and one of the side effects coming out of the strokes, in addition to having seizures and having the paralysis of his right arm and the difficulty in walking, is that he actually lost all of that knowledge. He was actually in university doing a second degree at the time, and because he came out without all of what we were accustomed to, his life was completely altered. And I'm an artist, and his sister's an artist, and if you look around the house, as somebody said, it looks like there's a Picasso explosion in here. There's art everywhere. And so I got to work in terms of using creativity, not necessarily art, but using creativity as a tool to see how I could jumpstart or to do more than just what the medicines were doing. Because there's lots of medicine and that was involved, and there was a lot of therapies, occupational therapy, speech therapy, physical therapy, all of the above. And so I threw in the creativity therapy in there, and yes, at first it didn't quite suck the word he used, but it was something that was outside of his wheelhouse, and so I tried him with different media, different techniques, different ways of making marks, and which is all he could do because he couldn't write after the stroke as well. He lost his ability to write. Coming out of the crisis of the acute chest syndrome, all these other things occurred. So the seizure management being one of them. But one of the other things that was very significant is that Kid in 2014 was diagnosed with a condition of sickle cell called avascular necrosis, and it was of the hip joint. And the necrosis is really the dying off of the bone. Mm-hmm. So what was happening to him, because the right side is weaker, and because, well, as I said, this happens to people with sickle cell, whether they have had a stroke or not, but the fact that right side was weaker, I, in my mind, I'm not a medical person, I think that kind of pushed that. And so he was walking much better between, say, 2016 going up to that point when this thing set in.
Started.
Yeah, it was a kind of very painful syndrome, kid.
Yeah, man. It was just excruciating pain, but
Yeah.
it just the bone just I think it basically dies.
Yeah.
Yeah.
So it's like bone on bone. That's what happens, you know. And that is something that happens to many people with sickle cell anemia. And I don't know if I can get technical because you know, but what happens is that the blood supply, the oxygen to the area, you know, it gets blocked off because of the sickling, and because the bone is not getting the oxygen, that's when it starts to deteriorate. So eventually it goes to a
It
point where
does.
the bone is bone. So
Yeah.
you have to have a hip replacement, and just to say that that's not an easy space either. That's a big surgery, you know, and
Yeah.
with big surgery comes big money. So you know, so I had to get in there and do some fundraising and sell some paintings, you know. So that for me, when sometimes I sit in the clinic and I'm sitting and yes, kid is having challenges and I feel for him, but then I start to look around at other people and I start to feel like, you know, how do they manage? You know, because getting kid up to the clinic in a car is a challenge when there's pain. But I can just imagine what it must be like for somebody in pain to hoof it out to the corner, to stand up, to wait for a bus, to get on the bus. Oh my, you know, I'm talking about it and I feel a little bit, I feel a little emotional. I feel tight right here. So it's hard. It must be hard for them.
His mama said it all, but I think, but being a part of the support system has been, I still, just recently, you know, go back to the days where Itwana was like 8 or 9, and he's a tall guy, and when he was having um, pains, I would be walking all night with him in the hand because he was just having pains. I just had to stay up with him. So there were many sleepless nights for the whole house, and there's nothing you can do. I remember him as a little boy before we even knew that he had sickle cell. His movement night began to dancing, and Kitwana is crying, and I am only a father, you know, and I never knew what was causing all of this pain. So, but after a time, we got to understand that, but it was almost, I said, traumatic, and you learn to live with it, but you never manage it. As for the stroke, those days, those weeks in ICU, it was something else because the entire family, all of us, spent almost like a shift system inside ICU.
So I wanted to share a little bit on that documentary, particularly with this particular family that overcame so much. On this documentary, I didn't get to show a little bit more about that. I'm going to show you another clip with another side, but he actually went and won a particular award for his art. So you can imagine he went through having a stroke and going through so much difficulty, but he overcame the challenges. Even his family, his mother used the skills she had of art, where he said he really felt no interest at first, didn't have the skill, but even his mom entered a contest and didn't win, but he entered his art and he won this particular award for his art. And just to show that he's come from far, but he used a skill that he has to accomplish a goal and a dream, just like all of us, that we can do the same. And knowing that even warriors go through harsh experiences, but thrive and survive and go through making the accomplishment of setting a goal and reaching it. So that was the key.
Carla,
Yes.
sorry to interrupt. I had to stop you for a moment. I'm not sure if everyone knows that Denise Robinson that's here today is the mom of
Yes,
Kitwana
I figured that.
video.
I figured that. I figured that. Denise,
Yeah.
thank you so much just for your
You're
input.
welcome.
Can you
Yeah.
share a little bit about the award that your son got?
Oh, it's my pleasure to do that. I'm a proud mother. He
Yes.
entered the JCDC. Well, I entered a couple of pieces of his in the JCDC, which is a Jamaica Cultural Development Commission, visual art competition. And that happens every year. And the competition is among Jamaican artists across the whole of Jamaica, and very few gold medals get capped. And I have actually entered the contest a couple of times myself. My art has actually been rejected by the adjudicators as not worthy of being seen. But he, in the year where they gave out 9 gold medals across the island, he won one of them. And so yes, we are very proud of that achievement, because as you saw, it came from a long way.
Yes.
Yeah.
Thank you so much, Denise,
You're welcome.
for sharing that. So the stories of inspiration definitely sets a tone. Those are victories. We have victories within us. Warriors have victories and stories to share, and it just encourages us. And also the very children that our warriors have, as well as siblings in the families that can share the journey of their sibling going through the fight of sickle cell. Everyone's story is an impactful story, and we're all here to make a difference. So you definitely have the power within. I want to definitely share another piece of the clip, which definitely was an inspiration. So just give me a moment.
Difficult in the sense that you're constantly sick, and it's difficult if you're going to school in keeping up with your studies, if you're working, maintaining that level of work experience that sometimes you want to give. It's important that you understand how to treat yourself and treat your body so that you can perform at your optimum. And without that information, without that knowledge, it makes your life what most would say a living hell. It's difficult to keep up with everybody else. As a male, you want to know that you can keep up with your peers. You can run, you can play football, you can swim. And these are things that sickle cell limits how much you can be involved. If you're playing football, you have to know how much you can push yourself. If you're running, if you're going to the beach, you have to know how much, what's your limit, not to get too cold, so you can't spend too much time in the water. So from that, you begin to feel like you're less of a man, because you can't keep up with what everybody else is doing.
It's a crisis for me, comes in different levels. I'll wake up some mornings, and that still happens. I wake up if the ground is too cold and you put your barefoot on the ground, you have spasm for hours. That still happens. I just know now when I'm getting up off the bed, you put a sock on, or you just chill a little bit till your body temperature come down. It's just my crisis starts in my legs, and I have a excruciating headache. So it's mostly my lower body and my head, and it feels like breaking your bone. It feels like somebody is literally taking a hammer and trying to break all your bones. It's the worst pain you could imagine. I find that public hospitals tend to look at you like you're an addict right off the bat. You come in ill, whether you are ill or not, you are treated like an addict. You will sit for hours in pain, but if you don't create a certain kind of, it's almost like if you don't behave boisterous, you're not in pain.
Going to the hospitals, it is ridiculous. Mind you, I don't think I have the worst experience because growing up, my father worked at the hospital, so I used to get care fast. But in the latter years, when you start to become conscious and you start to realize your rights and when you're not being treated properly, you realize that even within the hospitals, a place that is supposed to be for care, they can be so callous at times. They treat you like you asked for this yourself. I can recall a moment when I went to the hospital at 3 a.m. The doctor looked at me and said, "Where's your water? You know that you're supposed to be drinking your water." But at 3 a.m. in the morning, you're not thinking about getting water to go to the hospital. You're trying to stop the pain, the gruesome pain. And I believe that if they understood a little bit better, they would recognize that at 3 a.m., you're not just getting up out of your bed to come to the hospital.
And I really think that we have requested a meeting with the Ministry of Health to discuss some of these challenges and how the ministry can help to facilitate this health.
So that last person was Camille with the university. So I wanted, and that person before that was Noel, the person that made the documentary, putting it together. So I want to let you just know that your story means so much. And even in this network of the gentlemen that shared their limits that you have to think of, but you're limitless when you think of putting your limits and setting your goals. So understand that sometimes it may take you longer, but you can take the time out to see how you can accomplish your goal. Your mind is limitless to what you can achieve. And there's so much advocacy that seems not to be told, right? Untold stories. You have untold stories of your experience. And just like the young lady had mentioned, going to the hospital and maybe feeling less than, what can you do about that? We've had the same problem here in the US. What can we do about that? Talking to administrators, writing a letter, letting them know your experience. Sometimes they see us, parents and advocates, warriors and advocates at our worst, when we're most vulnerable, when our loved one is sick or when the warrior themselves is sick. How about letting them see us when we're well, when we feel good, writing that letter and letting them know what the experience was. Every facility wants to be the best facility, wants to be known that they're giving the best care, but they may not know that they have a healthcare professional that was not giving their best care to others and making them feel less than. We don't need that in the community. And that's all over, because that's happening all over in the US. So here's a time that you too, with your story and your voice, can also share and be that advocate. Let them know when they're treating you less than a person that needs to receive exceptional care. but do it in a graceful way. I know Andrea spoke about many times giving, how Shakira gave the nurses a thank you card when she went in. Definitely continue that as a momentum of saying thank you through your voice and through your actions when you do receive exceptional care. I know with myself and my son during the holiday time, because he was in there so frequently when he was in his about 12 to 14, we during those times, holiday times, we would come back and give cupcakes and give a cake to the unit, and just for during the holidays, just to say thank you. They saw us at our best then, because we were in there the times when he was sick. I wasn't thinking about giving them anything. I said thank you and treated them with the most respect, because that was the unit that cared for him. But during the times when he was well and at home, I'd let them know I didn't forget them. So even at the times when you go for a clinic appointment, think of how you can give a thank you card to that professional that treated you well. Or when you're in the hospital, if you do crafts, take a craft with you and put it in your bag, that maybe you can give someone that a gesture of kindness, because a kindness goes a long way. We all have a heart that we want to serve and do well to others, but we want to also let the ones that don't treat us with that optimum respect and ultimate heart to care, bring it to their attention gently and kill them with kindness, so they too will turn back and understand and hopefully be convicted of their actions. So there's so much ways that we as a community have to think our mindset. And I love the fact that we can share our stories in different ways. I would love us to have another opportunity where even you too can be on a broadcast where you can be able to share your story. The unit is Camille said that they was meeting with the minister of health there in Jamaica. It would be nice too that when you take the time, be able to send a letter to the same ones that are fighting for you, the advocacy. You can have a short letter and let them know in your area. I know that there's been some budget cuts in getting the medical team that used to come out, and now people have to go further in order to get treatment. Let them know the need is still there. Let them know how far you travel in order to seek the care that you get. Let the hospitals know that when you come there, you're so grateful for their care, but you also would like to know that maybe they have something in place for warriors as far as support, and take advantage of the support that you do have. I think Denise mentioned something. Andrea, can you read that?
Yes. She said, I remember the joy and appreciation that the persons at the clinic here showed when Kit donated one of his pieces to help decorate the waiting area. Wonderful.
Awesome. So you can imagine how that brings light. And I want to mention that one of the things that Shak's Hopes have been doing in order to just even shed the light on sickle cell is these events that take place. It's the wonderful events that take place in Jamaica when Shak Hopes comes out there, when Andrea comes out with Shak's Hope, and being able to give a little something in order to shed light. If it's that blanket, it might be a blue blanket that just takes your heart, that you want to take it with you when you go someplace. And just a little thing, maybe the shawl that you got, you remember someone cared and brought it all the way to have an event to give back. The same way that Kids Conquering Sickle Cell Disease Foundation, when I thought of the One Love project that we actually first introduced last year, it was particularly to provide education and also a toolkit in order to strengthen those that have sickle cell. No one thinks about maybe a heating blanket may be helpful when you're in pain. And I remember even going to the hospital when I thought about giving a electronic heating blanket. Even here, going to the hospital, I remember they have these disposable heating pads. And I remember going to the emergency room, my son used so much of them. And I think the staff got a little frustrated and she told me, well, we're out of them. And I said, it's a hospital. They have more than enough. I asked the nurse, well, can you go on another floor and get a couple more? It kind of soothes him. And I got so frustrated that just because that one staff was so tired of him using, I guess, the supply that they brought, but we were in there for so long. It soothed him. So why not get enough what would soothe your patient? So I remember going out and I told my son, I said, don't worry, as soon as we can get up on the floor, I'm gonna run out and buy you some heating pads because he had one at home. I said, I'm gonna go out and go buy you some heating pad. And he was just like, Mom, whenever you can, just get it, please. I went and asked the nurse again, can you please get from another floor? Of course, they came and brought me just a few. And I was just like, this is it. So I ran out, I got him 3 heating pads. We had one on the leg, 2, one on the arm, one in the other arm. And they then said, maybe you shouldn't be plugging it in the outlet. And I was like, no, we're gonna use this outlet because this is what he needs. And you didn't want to give me heating pads. So, they don't want to, they think it might start a fire or whatever it came. And it was about his comfort, right? Because he was in distressed pain. And I didn't want to seem like that, but just the small things sometimes matter when a patient is in pain. So I share that to say, you matter. Your pain and everything that you go through, whether sometimes it's not something physical that they can actually see or physically, but understand your value. Your value is within you. Also, caregivers, your value. You are appreciated, whether your warrior doesn't get to tell you often enough. We appreciate you. We value you. We thank you for all that you're doing. We are the support when no one else supports us. Just know that we are the support. So I wanted to also share that with you. Denise does art, and I'll be talking to Denise a little bit more, myself and Andrea, to see how when we do come out, how we can support an initiative for art, because I also wanted to share that your mental health matters. Your mental health matters. Your self-care matters. So I'm going to share something with you real quick. We are going to do a quick discussion on self-care. So there's so many types of self-care because our self-care matters. Physical, sleep, stretching, walking, physical release, healthy food, yoga, and rest. One of my favorites. Definitely, you have to think about your levels of self-care and what you can do to take care of yourself, because it also helps our minds. And Andrea, you can go and discuss about emotional.
Yes, so under different types of self-care, emotional, so we have stress management, emotional maturity, forgiveness, compassion, kindness. That is very important. As Carla was talking about, with your mental health and staying sane and just continuing to just think kindness, think happy thoughts, and in a way that you can manage your stress. It does help. Shakira used to say to me that I used to fly off the handle. And when I had a bout with my blood pressure and I was admitted, she says, Mom, you need to escape to the happy place. And imagine yourself having a fish and a bammy on the beach, even if it's not there. And that is how she escaped pain. So when we think positive thoughts, it relieves stress. When we forgive and we don't hold on to things, it's really ourselves that we are freeing from all that burden. And continue to be kind, non-judgmental, and just practice having compassion.
Yes, thank you so much.
Yeah.
And then we think about social. So the boundaries that we have to sometimes set even with people. So sometimes it's necessary to set those boundaries even with the support loved ones that we have. And if we have friends too, in order for us to maintain just the social well-being. Support systems. So we have to have support system in place. So we thought about, we spoke about that, having support systems. Sometimes it's not our family. Sometimes it's the immediate family. Sometimes it's friend. Sometimes it's our sickle cell network family. So I always call my close friends that also have siblings or they have children with sickle cell. I call them my sickle cell family. So having that support system in place. Positive social media. Sometimes it's necessary to take a break from social media. Social media can be stressful. Some people display a life of great that they're living, partying and getting to do these. And sometimes seeing those stuff can get you down. Sometimes you can look at something negative on social media and be upset about it, whether they showed a video or something that just not encouraging. Just be mindful how social media may affect your social life. And then communication. There's definitely times that you have to communicate with those loved ones that are around you. And in order to have effective communication, because we know we don't want to have arguments and yelling. That's not good for us emotionally, socially, physically, anything. So just knowing that, and a time together is so helpful. And knowing when to ask for help is a big key one. Sometimes it's nice to just be independent, but know when you need to ask for help. If you do know someone that can drive you somewhere and you don't have a car and you're feeling sick, or a person that pretty much can go with you when you're not feeling your best, don't be scared to ask them. The worst thing they maybe can say is no, or I don't feel like going, or whatever the case may be, but it's okay. Use them to the best of your knowledge to be able to think positive of their support, that they may support you, and ask for that help that you may need, because you are the one that's going to benefit from that. And understand too that your strength comes from within. So no matter what, you will find a way to get around to what you need. So understanding that it's okay to ask for help. And Andrea, can you go over the spiritual?
Sure. So time alone is important. Time alone with God, time alone to reflect, time alone just to breathe, time alone just to be still, to meditate, to do yoga, to connect with nature. It's wonderful what's around us that God has provided. Sometimes you just go outside, or if you can get to the beach or just be still, it is just so therapeutic and soothing to the soul. Journaling, writing down your feelings, writing down what you're thankful for, writing down about why you're grateful. Gratitude is also very important, right? Yes. And just having that space, having that sacred space where you can protect yourself and remain calm, because we know stress is a very big trigger.
Yes.
Okay.
Thank you so much. And definitely protecting your peace, protecting your peace at all aspects. Nurturing that peace. Live, enjoy fun things, laugh, love on yourself. Love on yourself. I shared a picture with myself at one of my loves, what I love to do. I love to go to the beach. So this is one of the pictures that I needed to get away. I live in Florida. So of course I get to go to the beach at times when it may be colder, just to see the scenery. It just soothes me. It feels good. Sometimes I don't go in the water. Actually, one of these days I couldn't even go in the water. It actually just rained, and that's why you see the sand looking so dark and black. But I got to see this nice, beautiful blue water, and it set a tone in me that I loved. And there go Andrea, the picture of her and Paul at an outing, enjoying life. So these are the things you need to live, enjoy fun times, laugh, and love on yourself. Do things that you enjoy. One of my other things that I like to do, and my kids talk about me sometimes doing it, I love to take a warm shower. I mean, it hot, steamy all over the place. Don't talk to me. Don't call me when my bathroom is locked. Like, that is my comfort zone. Like taking a long, warm bath. So I can't do it often, but when I do, oh my goodness, I stay in there and I enjoy my time. And I don't want no one to call on me for anything. Don't stop me and disturb me and ask me for anything. That's my peaceful moment. So those, you have to think about the things that gives you that positive mindset, that relaxes you, being able to help you revive yourself, rejuvenate that empowerment within, that you can revive yourself and feel that nourishing of your peace. So nourish that peace in every aspect. And for you, talk about what you enjoy doing. This was an outing with you and Paul. Tell us what you enjoy doing.
And if you notice the outing, right? I have a Shak soap card in my hand.
Yes.
Everywhere I go. Honestly, music is what the soul looks like for me. So wherever I go, it has to be in a space of music, even if I want to clean the house, a task that I may not like I hate to mop. I throw on the music, it gets me there, and it's just it's just good for the soul. I also love the beach, whether we're in the water or not. I just like to be close to it. To see it, it just brings you right down. And these things don't cost anything.
Yes.
To do, you know, and I think with intention, we should do these things for ourselves at least a couple of times a month. Yes. At least. Yes. Isn't it time for a trivia, Carla?
Yep, we're about to do another trivia. So, and the other thing again is, don't be afraid to seek professional therapists as necessary. So that's also important as you nourish your peace. Next trivia question about how many people are living in Jamaica, West Indies with sickle cell? Type it in the chat. We'll give a little time for that. And we're about to wrap up this session.
Anybody wants to guess?
Anybody want to guess? Who comes close?
Kimon Road, 300,000.
300,000? Okay.
Yes. Chrissy wrote 19,000.
Okay. We'll take one more guess.
Sorry.
Okay, so the answer is 19,000. That data was pulled from, actually provided from the Minister of Health in 2019. So that information is correct. It's about 19,000. We know that sometimes people migrate and even move down to Jamaica, and definitely more children have been born since then. But and I'm expecting in the next, by next year, they're going to get even newer data with an increase, because COVID actually seems to be a different rate for more babies being born, of course. So we'll probably see some new information also coming out. But yes, it was 19,000 living in Jamaica. So imagine the voice of all of the warriors in Jamaica, parents, siblings, and the very ones that are living with sickle cell, there is a voice to be heard and resources that are necessary. So definitely we will be talking more about being a support to Jamaica, and definitely showing you different ways of advocating for yourselves. So we skipped the break, so we're not going to go that. Does anybody knows what a next trivia question? What does TCD stand for, and what is it? A TCD that has to do with sickle cell. We know. We'll give 1 minute for that.
I guess they're Googling, Carla.
Yep, they're Googling. We'll just allow 1 more second, and then I will just share what that is.
So Tanisha wrote, okay, transcranial Doppler.
Yes, a transcranial Doppler. It is particularly a scan on the brain. A scan on the brain that pretty much has to do with those that usually get an annual scan to make sure that the cells in the brain is able to, the blood is flowing the way it should. And that particular test also detects at times strokes, because there's sometimes silent strokes that happen with sickle cell. So there's no signs or anything. Those are what the silent strokes are. And sometimes these annual tests be able to pick up these any kind of form of stroke. And they can also tell the risk of a stroke through the transcranial Doppler. They usually also ask for additional tests, an MRI and an MRA scan of the brain, in order to detect if something has happened, or looking at the vessels and making sure the blood flow, because we know sickle cell causes blockage, right, of the blood flow that can cause other complications. So thank you, Tanisha. That was really awesome.
And her son did one at UWI.
Okay, so I just don't want to take too much of your time. I wanted you to look at this impact. These words that are around impact, there's so many things that can impact the world. And when we think of the impact of sickle cell disease, I think about traditional care. I think about the measurements that can come from just researchers and different things. There's so much conversation that we can have because of how it impacts us and how we can impact the world. And it impacts so much. There's so much when we think about sickle cell and impact. You have within you to make an impact. You have it in you to write a book even about sickle cell. You have it in you to tell your story. Just know your voice means much. Your voice means much. Continue to set your goals. Continue to be the impact of the world. Any questions or thoughts anyone wants to share before we get ready to close? This is your time. You can unmute your mic if you can, or you can type it in the chat. Any thoughts and questions that you would like to share?
Come on, not everybody answer
Carla.
at once.
Can I share, Carla?
Sure.
Okay. Just want to step back a little bit to those strategies for coping.
Yes.
And both you and Carla and Andy, you're mentioning about the sea, the beach. And I know that both of you are speaking like, physically, you go to the beach and what happens and how you feel, and the feeling and the feeling and the feeling that comes through from being in a particular space and having a particular experience. And then we said that these things don't have to cost any money. In other words, you don't have to check into a fancy hotel and go on their beach or whatever. I have driven down to the Kingston waterfront and just sat and looked out at the sea from the waterfront. But just to say that even more accessible, what is even more accessible in terms of that kind of feeling is the process of visualization. So having had that experience, the brain, the mind doesn't know past, present, future. If I tell you now to cut a lemon and bite into the lemon and suck on the lemon, you start to, I saw that, Carla, you started to fold your lips in because you can actually sense the sourness. You can actually feel it. So it shifted your cells around a little bit, And so that's how visualization works, that you can just be in your bed, in your chair, in the hospital room, in your backyard, and just sit quietly and bring up those images, bring up those emotions, those experiences, and those emotions and those feelings will just naturally take over. And that same sensation that you'd have had actually going to the beach, you actually have it right there, sitting in your bedroom or your living room or your backyard or wherever you happen to be, on the bus, on a train. And that, for me, I do that a lot, and I encourage Kit and my daughter and my husband to practice that as well, because it is a fact that your feelings, your thoughts, your emotions can transform your life. If it is even just the way you think about the way that you are living and being. So I want to encourage people to take up the practice of visualization. Just find an image or an experience that has been powerful for you in terms of feeling good, whether it's somebody giving you a surprise gift, or you go out and it's a nice sunny day when it was raining really hard, or if it's like stepping into a warm tub on a very chilly day. I can relate to that warm shower story that you shared as well, Carla. And I'm going to also encourage you to do cold showers, not sickle cell people now. Those without the sickle cell, try the cold shower thing too. That works in a reverse kind of way. But that's for another conversation. But yes, the visualization is a technique that I think, those of you who are familiar with it, and if you do it, I encourage you to do more. Those of you who are not familiar with it, Google is there, YouTube is there, you can call me as well. But it works like a charm, just like going to the space. Thank you.
Thank you. Thank you so much. Denise. Love that, Denise. Yes, definitely. That visualization is so important. Because I love the beach so much, I have a picture with some water that I tend to look at when I feel like I just want to be there, because we have for us, it's an hour, 2-hour drive for me to go out that side to the beach. So I'm not there too often at all. I do look at my picture and visualize it, and sometimes just feeling the cool air outside and sitting outside when it's cool, I visualize when I'm in a beach atmosphere, and that kind of helps, because that drive is sometimes too much for me. So definitely visualization is so important. Anyone else wants to share anything and thoughts or questions before we go? We're here for your support.
No judgment. Don't be shy.
Yes,
unmute yourselves.
And if you have to go, it's okay. I know we're like 10 minutes over, but we wanted to also give a time for those that are needed to share. And we know some coming on, we had a little bit technical difficulties with some getting linked on. So, okay. Well, thank you. So I wanted to share some resources. There are some resources that you can always research. SC Info is a website that is very resourceful. They have videos, educational information on sickle cell. There's also clinicaltrials.gov. I know these clinical trials are in the United States, but please understand and know Jamaica has clinical trials also. And sometimes those clinical trials may be linked to also in the US. So right now they're doing a lot of trials with gene therapy as well as bone marrow transplants. Those are the two big ones. Being able to make sure that there is a cure on the horizon. Also, other medications. There are the medications coming out. I know Jamaica have hydroxyurea. GBT 440 is another medication that they've been doing some research out in Jamaica. That particular medication is actually it's the clinical name is GBT 440. But the other name for it is Oxbryta. So, and that's from Global Blood Therapeutics that's producing that medication. We're not here to promote any of these medications, but all this information is good for your knowledge. If you do have travel to the US on a regular basis for any kind of reason, you can always look into a particular treatment that maybe may fit your need if you're having some complication and see how they'll cover. Now, clinical trials they have funding to cover that. So, and you also have to have some follow-up and all that kind of stuff. So you can don't exclude yourself from treatments that may be in the US because you don't have the particular residency to actually be here. Look into it if it fits you and call and ask questions. It doesn't hurt to ask questions. If they say no, then that's fine, but also see what the university has and see how they can help you, especially if you're having complications never heard of. So research is being done on sickle cell, and it's so important to know what's being done, and especially if you're interested in particular treatments that may help you. And as you help as you help yourself be involved in clinical trials, it also helps others. So that's how medications actually come about. Somebody volunteered to be a part of a clinical trial. So just educating a little bit about that. And the university has a virtually monthly support group that's offered. I'm not sure if any of you on that WhatsApp. I know Chrissy's has information for that too. But you can also look on the website, get contact with Camille. I've joined the support group. I think 2 of them I went on, and they were pretty good. I mean, I really feel that it's a great support for the warriors. So just know that you also have that. And then One SCD is another website. Of course, Kids Conquering Sickle Cell and Shak's Hope is there also as a resource. And definitely, if you know or have a particular need, connect with your social worker or the doctor's office. Let them understand. And if you're interested in getting in contact with mental health resources, please talk with them, let them know the resources are there. Sometimes we just have to tap into them. So I want to thank you for definitely joining with us today. We thank our caregivers, warriors, and supporters for the support. We know that we are the family that are breaking limits against sickle cell, and continue to visualize those goals and definitely put them into action. What you want to achieve and achieve them. You are limitless. Just know that. Just make sure you think about what goals you can set and achieve. So we have to also think about those things. So definitely you can follow us on social media. Myself and Andrea, there's my contact information for WhatsApp. That's our business number that you can definitely connect with us on WhatsApp. Also, the email is there, admin@Kids Conquering Sickle Cell Disease Foundation, and also Shak's Hope @gmail. So we are concluding this time. We're going to end with the affirmation. If you can follow me, I'm going to say something really short. Just repeat after me. We're breaking limits.
We're breaking limits.
I am empowered.
I'm empowered.
I can achieve my goals.
I can achieve my goals.
I can achieve my dreams.
Can achieve my goals.
I can achieve my dreams.
I can achieve my dreams.
I'm breaking limits.
I'm breaking limits.
I am going to be successful.
I am
going to be successful. I am going to be successful.
I define success.
I define success.
I am successful. I am successful.
I am successful.
I am successful.
I'm breaking limits.
I'm breaking limits.
Breaking limits.
I am the warrior.
I am the warrior.
That defines achievement.
Defines achievement.
That will define achievements.
I'm breaking limits.
I'm breaking limits.
Breaking limits.
Awesome. Thank you so much. Know that you're breaking limits. You are breaking limits. You are made to achieve your goals and you are defining success. So continue to embrace your achievements. Continue to embrace your celebrations. Continue to break those limits of success. So thank you so much for joining, and we are closing, and we thank you. You have our contact information, and have a great weekend. And we will see you on the 21st. The May 21st. We have a great surprise coming up. It's not actually a surprise, but we will be talking about scholarship, being able to give 3 scholarships out for different age groups. So we'll talk more about that in the next session. And I thank you so much for joining, because we are the family of support that we can continue to use our voice to advocate and support others. So have a blessed weekend and continue breaking limits.
Okay,
Love you all. Thank you so much for joining.
Thank you.
Bye.
Thank you.
Bye.
Thank you. Love you too.
Bye-bye.
Love you too.
Bye.
Lots of love.
Bye.
Bye.
Thank you, Tanisha. Lots of love to you too. Thank you, Jacqueline. Thank you for joining. Thank you, Stacy Ann. Thank you so much. Also, you, Christy, have a beautiful Saturday. Thank you for joining.